Hey there, it's Dr. Jim Collins, and welcome to my messy office. You know what they say about a cluttered desk, right? Today's topic, antibiotic stewardship in senior care. Now, this is something that I was not completely aware of. I'd like to admit that out of the gate. But some of our clients have asked for more information on this topic. So, as an applied gerontologist, what do? Start researching. And I come up with a lot of information and then I share it with thousands and thousands of people across the United States. So, this is antibiotic stewardship in senior care. This is no surprise to you, without a doubt, and this was no surprise to me. Antibiotics are among the most prescribed medications in skilled nursing facilities across the entire nation. Up to 70% of residents take one or more courses, not just a pill, courses. Take all your antibiotics until they're done, every year. Up to 70% of residents take one or more courses of antibiotics every year. That is a lot. According to the CDC, similar to the findings in hospitals, studies have shown that between 40 to 75% of antibiotics prescribed in nursing homes may be unnecessary or inappropriate. Are we overprescribing? There are many potential harms from antibiotics, including serious diarrheal infections, C. diff, and an increased adverse drug event or drug interactions. Colonization and or infection with antibiotic-resistant organisms, that's a big one, may also be a serious negative outcome of the overuse of antibiotics. What is antibiotic stewardship then? The Centers for Disease Control and Prevention, or the CDC, provide core elements of antibiotic stewardship that are aimed to improve the use of antibiotics in healthcare, protect residents, and reduce the overall threat of antibiotic resistance in the United States. Big goals. Antibiotic stewardship refers to a set of commitments and actions that are designed to, quote, optimize the treatment of infections while reducing the adverse events associated with antibiotic use, end of quote. And that is from the CDC itself. The CDC recommends that all nursing facilities implement an antibiotic stewardship program, or abbreviated an ASP, and use the 7 core elements for implementing it. I really highly recommend that you go to the CDC and look up the core elements of antibiotic stewardship. But I do want to give you a little bit more information, though. According to the CDC, quote, nursing homes are encouraged to work in a stepwise fashion, implementing 1 or 2 activities to start, and gradually adding new strategies from each element over time, end of quote. So start low, go slow, get it done the right way. It's impossible to implement all of these core elements at once, and there are 7 of them, like I said. So the CDC also states that, quote, any action taken to improve antibiotic use is expected to reduce adverse events, prevent emergence of resistance, and lead to better outcomes for residents in this setting. Okay? So these are important. And the last thing I want to introduce, here are the 7 core concepts. They include leadership commitment, accountability, drug expertise, action, tracking, reporting, and my favorite, education. I'm out of time. I'm Dr. Jim Collins, but I do want you to Google the 7 core elements of antibiotic stewardship. I think you will find it informative, practical, and it can improve or save the lives of the seniors that you're caring for.